Hi everyone, now we're doing the examination of the vagus nerve, which is the 10th cranial nerve. Okay, so now this has three nuclei. You have the main motor nucleus, you have the parasympathetic, and you have the sensory. These are completely similar to that of the glossopharyngeal, main motor, parasympathetic, and sensory. Main motor nucleus is known as nucleus ambiguus, and this is present in the medulla oblongata. So if you can recall the anatomy, here I told you this is the vagus nerve, and it has the three nucleus. So main motor, and then it has nucleus ambiguus, which is the main motor, right? And then it has the dorsal vagal. Right here you can see dorsal vagal and you can see nucleus of tractus solitarius. So you may have already guessed sensory is the nucleus of tractus solitarius, parasympathetic is dorsal vagal nucleus, and main motor is the nucleus ambiguus. You can also see it right here. This is the nucleus ambiguus, main motor, and then you have the dorsal vagal, which is the parasympathetic, and nucleus solitarius, which is the sensory, nucleus solitarius sensory, right? Now, the sensory this is a mixed nerve. It gives both sensory as well as motor innervation. Sensory innervations are given to the external ear, dura mater, larynx, and the pharynx. Motor innervation are given to larynx, pharynx, and soft palate. You can see the muscle tables on in your Snell's book, and you'll notice how the entire larynx it is supplied by recurrent and external laryngeal nerve. So those are the branches of the vagus nerves, right? Then, if you talk about pharynx, I told you already that all of those muscles are supplied by the vagus nerve, except xylopharyngeus, which was supplied by the glossopharyngeal nerve. And then, if you look at soft palate as well, so you will notice that you have tensor villi palatini, levator villi palatini, platoglossus, palatopharyngeus, musculus uvuli. All of these are supplied by a vagus nerve, pharyngeal nerve, except for if you can recall tensor villi palatini. So tensor villi palatini, where did I already teach you? So tensor villi palatini, we already studied here. And the trigeminal nerve. So you have tensor villi palatini. So remaining all of the soft palate muscles, pharyngeal muscles, except the stylopharyngeus, and all of the laryngeal muscles are supplied by the vagus nerve. So larynx, pharynx, and soft palate. What's the exception in pharynx? Stylopharyngeus. What's the exception in soft palate? Tensor villi palatini. So that's supplied by trigeminal. And the exception in pharynx was supplied by the glossopharyngeal nerve. And these are the motor innervations. Now, in cases of lesion of the of the vagus nerve, what will happen? There will be palatal palsy. Palatal palsy basically means that there will be a nasal twang in the voice. So, for example, the person, if he is saying egg, he won't be able to say egg. Instead, he'll say eng, like that. There'll be a n sound, n sound, right? And another lesion, if for example, if there's a lesion, the other complication can be regurgitation of the fluid. Now, I already told you that it supplies the soft palate muscles, right? So if the palate muscles are not working properly, there'll be regurgitation of fluid through the nose during the swallowing, because your soft palate muscles they basically close the oropharyngeal isthmus, they proximate the oropharyngeal isthmus, so that oral cavity and nasal cavity they're separated. So what happens is that that doesn't happen, and all of the uh, food or fluid, anything that is swallowed, that regurgitates through the nose during swallowing, and this is due to the paralysis of the soft palate. For the test, you have R test and the gag reflex. For R test, you have to ask the patient to say ah, and while they're saying ah, you have to first of all you need to ask the patient to open the mouth. Once they open the mouth, you need to use the tongue depressor and depress the tongue, and then you need to ask them to say ah, right? So open the mouth, use a tongue depressor to depress the tongue, and then you have to ask them to say ah, and then hold the torch and look at the movement of the soft palate. If the palate is moving properly, it means well and good. The vagus nerve is functioning. If not, you'll notice that the median raphe it is being pulled towards the healthy side. So that is the R test. For gag reflex, you have to ask the patient to open the mouth and tickle the back of the pharynx. And then gag reflex, we already studied in glossopharyngeal as well. And then if you tickle, you'll see that there'll be contraction of the pharyngeal and soft palate muscles. In case of absence of gag reflex, what happens is that it means that there is damage possibly to the glossopharyngeal nerve or either to the vagus nerve, or there is brain death, or there's some sort of uh, issue with the medulla oblongata particularly. And afferent for this gag reflex is supplied by the glossopharyngeal, whereas efferent is supplied by the vagus nerve. And yeah, so that's pretty much it. You can use laryngoscopy to see the movement of the vocal cords as well. So vagus nerve, pretty easy.